Dear students, welcome back. In this session, we are going to discuss about the medial side of the leg, some of the features, and very important region on the medial aspect of the leg is the attachment of gyropes. Okay. So normally the medial side of the leg is formed by the medial surface of the shaft of the tibia. Okay, and the greater part of the surface is subcutaneous and is covered only by the skin and superficial fascia. In the upper part, here we can see in the upper part, however, the surface provides attachment to the tibial collateral ligament near the medial border. Okay, and then it also provides insertion for the gyro muscles. So the gyro muscles are the three muscles which forms gyropes are the sartorius, gracilis and semitendinosus muscles. These three muscles which are related to three different compartments of the thigh region. Okay, so and which are also corresponding to the three elements of the hip bone. So now we will see the sartorius belongs to the anterior compartment of the thigh. Here you can see the sartorius. The sartorius belongs to the anterior compartment of the thigh and which is attached to the ilium of the hip bone. And if you see the gracilis belongs to the medial compartment of the thigh and are supplied by the obturator nerve. Okay, and this one is related to the pubis of the hip bone. And if you see the semitendinosus, which belongs to the posterior compartment of thigh and is which is supplied by the sciatic nerve, and this corresponds to the ischial tuberosity of the hip bone. That means these three muscles corresponding the three elements of the hip bone. Okay, these three muscles are anchored. So that means all the three muscles are getting inserted at one point. Okay, that is at the medial side of the leg, that is tibia, and these spread out above. So here the tendons are anchored at the medial side of the tibia, on the anterior medial side of the tibia, and above it spread out. So above, all these muscles are spread out to span the pelvis like the strings. Here you can see like the strings of a tent. Okay, that means these kind of arrangement appears like gyropes. Okay, these are called gyropes. So these muscles are called as gyropes, which helps to stabilize the bony pelvis on the femur. So that is the importance of this gyropes. That means the gyropes mainly stabilize the bony pelvis on the femur. Here the insertion at the medial side of the leg is important. Okay, and this gyropes is a very important question, frequently asked question in vivas. Okay, and if you see the Anserine Bursa, which is also related to the medial side of the leg. So this bursa is large. Okay, you can see this bursa is large and complicated with several diverticula. Okay, it separates the tendons of the gyropes, that is sartorius, gracilis and semitendinosus, and also mainly at their insertion from one another, and also from the bony surface and from the tibial collateral ligament, So this is about the Anserine Bursa. Okay, and also some of the structures related to the medial side of the leg or the great saphenous vein, and also this tibial collateral ligament are also related on the medial side of the leg. Thank you.